Primary hyperparathyroidism is a condition where the parathyroid glands make too much parathyroid hormone, PTH. The extra hormone pushes calcium from the bones into the blood, acting like a thermostat that is stuck on high. Most often this happens because one gland grows a harmless tumor called an adenoma, but sometimes several glands become overactive, hyperplasia, or very rarely, a cancerous growth, carcinoma, develops. The main cause is a single adenoma, a non-cancerous lump that appears in one of the 4 glands. Less often, all the glands enlarge together, hyperplasia, because of genetic factors or long-standing low calcium. Carcinoma, the cancer type, is extremely rare and usually linked to genetic mutations. Even simple things like low vitamin D or kidney problems can make the glands work harder, setting the stage for an adenoma to form. People with primary hyperparathyroidism often feel vague symptoms. Imagine a rocking chair that creaks. The shaking is like bone pain or fractures. Common signs are weak bones, kidney stones, feeling very thirsty, tiredness, and stomach upset. Some notice a brain fog or mood swings because too much calcium can affect the nerves. The symptoms may be mild, so many discover the disease by a routine blood test. Doctors first check blood calcium and PTH levels. High calcium with high PTH points to primary hyperparathyroidism. Imaging tests, such as a small neck ultrasound or a special scan called a Treatme scan, help locate the adenoma or hyperplastic glands. Treatment depends on the cause. Surgery to remove the problematic glands is the cure for most adenomas and hyperplasia. If surgery is not possible, medicines that lower calcium or protect the bones can be used. Carcinoma may need more extensive surgery and sometimes radiation. You cannot completely stop a gland from becoming an adenoma, but staying healthy lowers the risk. Keep calcium and vitamin D in balance by eating dairy, leafy greens, and getting sunlight. Drink enough water to keep kidneys flushing out excess calcium, and exercise regularly to keep bones strong. Managing kidney disease and avoiding long-term low-calcium diets also helps. Recent research is testing minimally invasive blood tests that can detect tiny changes in PHT-related proteins before an adenoma grows big enough to be seen on scans. New drugs that specifically block the PTH receptor are being studied and may offer an alternative to surgery for people who cannot have an operation. Early studies also suggest that a high-resolution 4D CT scan can pinpoint tiny adenomas more accurately, shortening surgery time.